I'm Dr. Paula Lantsberger. I want to talk to you today about the deathly consequences for Washington families when they don't have access to health care. I had a 32-year-old patient who lost her health care insurance because she had an injury on her job. She couldn't afford her asthma inhalers for her lifelong asthma because the inhalers now cost $70. She couldn't afford an ambulance ride of $800 to the emergency department because that would make her homeless. She certainly couldn't afford thousands of dollars worth of emergency room care to go in for treating an asthma flare. It was spring. Her asthma flared up, and she waited at home as long as she could. In desperation, she called her brother to take her to the emergency department. After fighting traffic for 45 minutes, he arrived at his sister's house to watch her walk from the front door to the driveway and collapse and die in her own driveway. This was an absolutely preventable death from a 100% treatable condition, but only if you have health insurance. I had another patient tell me of his young wife's death from breast cancer. She refused to have it treated because she wasn't going to make her family homeless and force her husband into bankruptcy to afford cancer treatment without health insurance. I volunteered as the medical director for Project Access for the Spokane County Medical Society. This was a charitable program that provided free medical care for people who were within 200% of the poverty line. These people were desperate for care. They had conditions like brain tumors, blinding cataracts, huge herniated discs, breast cancer, and others. Prior to the Affordable Care Act, we had over 100 people applying every single month for the donated charity health care. After the Affordable Care Act, that dropped to less than 4 people a month seeking care. People had real health care, and they didn't have to beg for charity. Washington State has the chance to lead the nation and provide a basic human necessity, which is health care. I never want to see another patient die from a 100% preventable condition. No one should sacrifice their lives so that their family doesn't become homeless and bankrupt from the cost of medical care. Now is the time for our legislature to pass affordable health care, and now is the time for you to contact your legislator. Tell them now is the time for health care in Washington State. I insist that we fight for health care for all.